My name is Lizette Delgado-Polanco. I'm the Executive Director for the Service Employees International Union, New Jersey State Council. We are here today together to stand with Mayor Fulop and the members of City Council in support of earned sick days legislation. The ordinance proposed by the mayor would be a huge step forward for over 30,000 Jersey City workers and 1.2 million workers statewide who lack the basic economic security if they or a family member is ill. We represent a broad coalition of labor, community groups, ordinary citizens, and all who come together in the fight for what should be the fundamental human right. Today, you'll learn why the bill isn't just the right thing to do for Jersey City, it's the smart thing to do for its economy and public health. First, I am honored to introduce Mayor Stephen Fulop, whose leadership on this issue has made this opportunity possible. Mayor?
I do have to give credit where credit is due. I'm here with several members of the City Council as well that have taken time to be a part of this process. And this was something that's been an ongoing dialogue with the rest of the City Council. We have Candace Osborne, Diane Coleman, Council President Rolando Lavarro, Joyce Waterman, and Danny Rivera, all up here that have had input in this process. From my standpoint, and from their standpoint, it really is exciting that Jersey City really has an opportunity to lead the way on this important issue. We view it really as a basic human dignity type of issue. It's a women's issue, it's a family issue, it's a worker issue, and really there's an opportunity here for Jersey City to do something very, very special, and hopefully it's replicated throughout the state in the near future. So this is something that we're excited about. The first reading is going to be on Wednesday, and we couldn't be more excited to be leading the way on this.
Good morning. My name is James Burkis. I work at I'm also a security officer that works and lives in Jersey City. I'm here today to support the sick days legislation. Workers like myself and my kids get sick, I have to take a day off. And once I take a day off, I don't get paid for it.
I'm here today representing New Jersey Citizen Action and also the Time to Care Coalition, which is a diverse group of 65 labor, senior, community, research, and advocacy organizations that have come together committed to improving workplace programs and policies. Everyone benefits when workers are able to balance job obligations and family needs. Giving workers financial security by allowing them to take paid leave to deal with their own illnesses or to care for a sick loved one not only improves outcomes for children and family, but it also benefits businesses by decreasing turnover and raising worker morale. It's been a really exciting year for us. The passage of earned sick days across the river in New York City has given our movement here in New Jersey real momentum. In May, we stood with Assemblywoman Pamela Lampert as she introduced a statewide earned sick days law in Trenton. And today we are so proud to be standing with Mayor Fulop and the City Council of Jersey City in their effort to make Jersey City the first city in the state and the sixth city in the country to implement this common sense policy. Passing this law would be a great big first step, but it won't be the last step. One of the most exciting provisions of this law is that it mandates a study to examine the impact of the ordinance on Jersey City residents and businesses. This will provide us with a great opportunity to show how earned sick days not only strengthen families but also boost the economy as a whole. The experience of cities and states that have already passed an earned sick days bill shows that healthier workers are better workers, and that workers who aren't losing pay or their jobs because they're sick are much, much better consumers. In Connecticut, the sectors of the economy most impacted by paid sick days law have actually grown. And most telling, perhaps, is a study that was completed on the city of San Francisco, which 4 years ago put in a earned paid sick days bill. And the study ended up showing, after 4 years of operation, that 2/3 of all businesses now support the law. 6 out of 7 employers report that they have seen no negative impact on profitability. And PricewaterhouseCoopers has ranked San Francisco as one of the top cities in the world in which to do business. We're confident that Jersey City's experience over the next year will make the case for expanding the law in Jersey City and extending earned sick days to every single worker in the state of New Jersey. This is a bill that will be good for workers, is good for families, and is good for businesses. And Mayor Fulop and the City Council should be commended for their move to pass it. Thank you very much.
One of the reasons why I'm here this morning is because out of these 30,000 workers that are affected by not having any paid sick days, I have the privilege of pastoring many of them. And unfortunately, over half of Latinos like paid sick days. 64% of Latino men and 50% of Latina women can't earn a single sick day to take care of themselves or a family member when faced with illness. So I believe that this is a common sense type of proposal that our mayor and our city council is bringing forth, that we must not only support, but we need to make sure it goes through and it passes. For our Spanish-speaking friends, I'd like to say, lamentablemente más de la mitad de nuestro pueblo latino que vive aquí en esta gran ciudad de Jersey City carecen de días pagos por causa de enfermedad. El 64% de hombres latinos y el 50% de mujeres latinas no pueden honradamente y dignamente trabajar para acumular ni tan siquiera un solo día para cuidarse a ellos mismos o a un ser querido que esté enfermo. Por esa razón hoy estamos aquí para apoyar a nuestro alcalde Fulop, a todo nuestro consejo, porque esto es lo correcto y es lo que tenemos que hacer. Thank you, and I'm here to support our mayor again because this is the right thing to do. It makes total sense. Thank you.
The New Jersey Working Families Alliance is honored to stand here with Mayor Fulop and members of the City Council, as well as partners and allies from across New Jersey, on to pass this important legislation. As a Jersey City resident, I'm honored as well. This legislation is premised on the simple idea that getting sick should never mean getting fired, and that a worker shouldn't have to choose between their family's health and earning a paycheck. Policymakers across the country have come to realize that earned sick days laws are sound public policy that protect our workers, strengthen our families, and promote public health. Cities and states around the country are realizing the value of earned sick days, but we're honored that here in New Jersey, Jersey City is leading the way, and Mayor Fulop and the City Council are taking the first step to make New Jersey one of the leaders on this important legislation. So thanks a lot. We're honored to be here.
The NAACP is dedicated to advancing economic, social, and racial equality. We view this legislation as a fundamental component of a pro-worker agenda. Let's be clear, working New Jerseyans are falling behind. Our economy is recovering more slowly than other states, and the jobs we're adding tend to be low-paying jobs in the service and entertainment field. Unfortunately, these are exactly the jobs that don't offer a chance to earn sick days. And make no mistake, African Americans are disproportionately impacted. Nearly 7 million African Americans, that's 44%, aren't able to earn a single sick day to recover from illness. That's ridiculous. This is a matter of simple fairness, and the NAACP is proud to work in coalition with the allies gathered here alongside Mayor Fulop in making sure every resident of Jersey City, and eventually all of New Jersey, has what should be a basic economic right. Thank you.
It's an honor to be here, to join with the mayor and the city council to support this wonderful legislation. It shows when everyone comes together in the community that we can stand up for workers' rights. No worker, just like James, should have to choose between losing 20% of their pay for a week and taking care of their kid or themselves. In addition, for food service workers, they should not have to go to work and cough all over your food and make the germs go into your food. It's not good for the city of Jersey City. It's not good for the state of New Jersey. We think that this is a wonderful legislation. I'm honored to be here with this wonderful coalition, and together we can make incredible things happen for the working people of this city and above this state. Thank you very much.
As a registered nurse, I can say emphatically that earned sick days aren't just a matter of workers' rights. They're critical to protecting public health. Workers who can't take off time to deal with an illness wind up taking their germs to work with them. The CDC may call for workers to stay home when they catch the flu, but 30,000 New Jersey workers just don't have that choice at all. This could have a huge impact in preventing contagion during flu season and deadly disease pandemics. Researchers estimate that if all U.S. workers had been able to earn paid sick days during the 2009 H1N1 flu epidemic, 5 million infections could have been prevented. Workers without paid sick time also run the risk of ignoring conditions that can be addressed with early and preventative care. As a nurse working in a major hospital, I'm constantly confronted by patients who have waited too long to take care of an illness or a condition and made that problem that much more difficult to address and expensive to pay for. Finally, new research from the National Health Interview Survey finds that workers with paid sick days are more likely to visit the doctor at least once a year and get cancer screenings at recommended intervals. Paid sick days mean fewer trips to the emergency room and more savings for taxpayers. This bill is a big step towards not just a fairer, but also a healthier city. The City Council should pass it without delay.
This ordinance allows workers to earn, and I emphasize earn, this is not a giveaway, their sick time, and that's important. A couple of reasons why this bill is important to us at AARP. First of all, some of the things that Nicole said. The worker will be able to take care of his own health needs. He'll be able to catch his illnesses earlier, be able to get preventive care, which lowers health care costs, which is of great concern to AARP. He'll be able to avoid contact with others when they are ill, which means that food service workers, for example, will be less likely to spread illnesses to school children, hospital patients, which is an area we're very concerned about, and restaurant patients. And of course, finally, to be able to stay at home with family members when they need care. And as president of AARP, I'm particularly happy to say that the definition of family in this ordinance includes grandparents and grandchildren. So we at AARP are very happy to stand here today with the mayor and the city council and the other organizations supporting this bill. Thank you.
It's a pleasure to be here with Mayor Fulop and my council colleagues and our partners and all the workers who are standing with us today in support of earned sick days. I want to first off applaud our mayor for really having the courage and leadership and vision to put this legislation forward. In this very tough economy, benefits for workers have been consistently chipped away at. Earned sick day reverses that trend, at least here in Jersey City, and hopefully it will be a model for the state of New Jersey. This is good public health policy, reducing the likelihood of disease spreading in our communities. While the public health benefits are irrefutable, the most important thing is that this legislation will provide economic fairness to working families, and in an intensely competitive job market, workers shouldn't have to choose between their health, their family's health, and whether they should keep their job. Some may decry the cost to small businesses, but we know in places like San Francisco and in Connecticut that earned sick days has not hurt the bottom line, that the cost is negligible, and the gains in productivity far outweigh the costs. Most importantly, earned sick days is the right thing to do for working families who are striving for the American dream and are the backbone of our economy. I strongly support this legislation, and we will do everything we can to see it passed. Thank you.
So I've been looking at other areas around the country that they've done this sort of earned paid sick days. Obviously, it was a issue in New York across the river the last 6 months. It was something that was passed over there, and I thought there was an opportunity for Jersey City to really lead the way in the state of New Jersey. So we've had a lot of dialogue between the City Council, my office, some of the different stakeholders, and I think we have something here that's really going to be a landmark for for Jersey City and for the state. You're talking about tens of thousands of people. You're talking about working families that risk their job or are concerned about losing their job if they get sick, and or if their child gets sick or their parent gets sick, somebody in their immediate household. And you're talking about Jersey City over time becoming a trend here, that you see a lot of investment coming into Jersey City, which is a good thing, but you also want to strike the balance and make sure that this is a place that the working family can still not only work but also live. And the policies that we were trying to put forward strike that balance. So whether it's incentivizing tax abatements into other parts of Jersey City away from the waterfront, or this earned paid sick day ordinance, what they're doing is really creating that balance in Jersey City. We're going to kind of pave the way, and then we'll see what happens in Trenton. In Jersey City, you've had some concern from some of the small businesses, but again, studies have indicated that the cost to them has been negligible despite the initial concerns, which I think is a significant point. So, we have a commitment here that in a year we're going to have Rutgers commission a study in order to assess the impact, and then we'll adjust it accordingly. So we're all on the same page on that front.